Hey there, I'm Dr. Tickle. What brings you in today?
What's up, Doc? Thanks for seeing me. I really appreciate it. I haven't really been myself lately. I was hoping you could help.
Well, how so? What's different?
Well, I don't know if you can tell, but I've been a little jerky lately. I'm having trouble controlling my movements.
I see. Any other problems by chance?
Well, now that I think about it, my eyes are moving a little bit slower than before. And it's also hard to walk a straight line. And that usually only happens when I have a couple of drinks, if you know what I mean. And I kind of feel like my muscles are a little stressed, I guess, or something.
Do you usually have that much trouble coming up with a phrase?
That's kind of rude, man. What?
It's for diagnostic purposes. Have you had trouble focusing, staying on task, stuff like that?
Well, yeah, actually, I'm an accountant, and I look at spreadsheets for a living. And for the life of me, I've been having a real hard time getting all my work done on time. It's never been a huge problem before, but we have a new policy, and I can't seem to learn how to do it.
Okay, I see. I think I know what the problem might be. Has anyone in your family ever been diagnosed with Huntington's disease?
Yeah, actually, my father passed away because of it a couple years back, so I was always worried that I would get it too.
Okay. Well, from everything you've told me, unfortunately, that may be the case, but we can run some blood tests to be sure.
Yeah, sure, whatever you need.
All right.
Hi, Dr. Tinnesz.
Hey, what's up? I'm James.
We conducted your test on your DNA, and I'm sorry the results aren't good.
Oh, no.
We've confirmed you have Huntington's disease.
Are you sure?
I'm sorry, but yes. Our DNA testing indicated that you have over 40 CAG repeats in the IT15 gene, also known as the Huntington gene, on chromosome 4.
Wait, what's CAG?
Oh, my apologies. CAG stands for cytosine, adenine, and guanine. These are 3 of the 4 nucleic acids that make up your genetic code, with thymine being the 4th. A normal IT15 gene will have less than 28 of these CAG repeats. Yours, unfortunately, had well above 40, indicating a strong mutation.
Wait, well, geez, how did this happen? Was there something I could have done to prevent this?
No, Huntington's is a genetic disorder. Specifically, it has an autosomal dominant pattern. This means that the disorder doesn't discriminate in terms of gender. Both male and female children of a person afflicted with Huntington's has a 50-50 chance of developing the disease. You received the disease from your father's genetic code.
Oh, well, is there a cure?
I'm sorry, but there is no cure. However, you can manage the symptoms of your involuntary movements, also known as chorea, via tetrabenazine, a compound that reduces the amount of dopamine reaching cells. You could also use antipsychotics to reduce chorea, but I wouldn't recommend it because they can sometimes worsen the symptoms. Benzodiazepines can also potentially help.
Well, how long do I have?
Well, it varies per person, but you could potentially have roughly 20 more years post-diagnosis. This is what I expect considering you're middle-aged. Someone younger than yourself, younger than 20 or older than 49, on average has 1 to 2 less years than you.
Is there anything else I can do to improve my symptoms?
Keep up with your exercise, visit a speech therapist, anything to keep motor functionality for as long as possible. But otherwise, I'm sorry.
All right. Well, thanks, Doc.
Thank you.
Appreciate it.
Huntington's disease is a fatal genetic disorder that causes progressive breakdown of nerve cells in the brain. It is characterized by uncontrolled movements called chorea, mood swings, and chronic depression, as well as impaired cognitive functions such as memory and judgment. Huntington's disease is quite rare because it is a family-linked disease, meaning only children of those with Huntington's disease are at risk of the disease. Currently, there are close to 30,000 reported cases in the United States alone, and approximately 200,000 people are at risk of inheriting the disease. A diagnosis of Huntington's disease is determined from a general physical exam, answers to questions, family medical history, and genetic testing. The disease is received from your parents and has an autosomal dominant inheritance pattern, which means receiving a single mutated gene will result in the inheritance of the disease. Therefore, it does not discriminate between gender, and any child of someone affected by the disease has a 50-50 chance of receiving the mutated gene. Huntington's disease is typically an adult-onset disease. However, there have been many cases of symptoms showing up in adolescence. There are 3 stages of the disease: early, middle, and late. Initially, the symptoms of Huntington's disease are subtle, with mild memory decline, behavioral changes such as depression and irritability, and minor difficulties in coordination and balance. In the middle stage, the symptoms begin to interfere with everyday life. During the late stage, people with the disease must rely completely on other people for care, and walking and speaking are not possible. These symptoms typically show up between the ages of 30 and 50. However, they can often go unnoticed or be attributed to other causes. Most patients define their age of onset of the disease when they begin to experience chorea, which is an abrupt, jerky, uncontrolled movement, usually limited to the shoulders, hips, and face. As the disease progresses, the symptoms gradually worsen, with chorea becoming more prevalent and cognitive impairment severely affecting clear thinking and logical reasoning. Eventually, the patient's symptoms will degrade to the point where they can no longer walk or form speech, and must therefore be provided with constant care. This process takes effect over a 20-year span after diagnosis. However, there are of course exceptions, with cases of people living only a year after diagnosis and others that have lived more than 40 years after diagnosis. Most people with Huntington's disease do not actually die to the disease, but rather from normal hazards such as choking because of complete loss of motor function in eating mechanism.
In 1993, the discovery of the gene mutation directly responsible for the development of Huntington's disease led to much better understanding of the disease and how to test for those that might later develop the disease. The IT15 gene, now known as Huntington gene, is located on chromosome 4 and is responsible for encoding the protein Huntington. The purpose of the Huntington protein is not fully understood, but has been found to play a role in normal processes such as axonal and vascular transport, endocytosis, postsynaptic signaling, and cell survival pathways. When testing for Huntington's disease, doctors specifically look at the number of CAG repeats within the Huntington gene. CAG refers to cytosine, adenine, and guanine, some of the nucleic acids that make up your genetic code. Someone with Huntington's disease will have over 40 CAG codon repeats within their Huntington gene, whereas a normal person will have anywhere between 15 and 25 CAG repeats. Higher repeat lengths are associated with earlier onset of the disease symptoms, but only accounts for about 50% of predicted onset age.
The mutated Huntington gene usually undergoes N-terminal cleavage, which produces polyglutamine fragments that can oligomerize, meaning to form a compound intermediate between a monomer and a polymer. The resulting aggregates are implicated in the toxicity of the disease. This toxicity causes mitochondrial dysfunction, transcriptional dysregulation of various proteins, altered axonal transport of significant factors, disrupted calcium ion signaling, abnormal protein interactions, and autophagy. The critical component of the disease is the overall cell loss and gliosis in the brain. Gliosis refers to the reactive response of glial cells in the central nervous system following trauma or damage. More specifically, it is the proliferation of astrocytes in the damaged area of the brain, and this proliferation produces scarring of the brain tissue as the produced astrocytes work to contain the damaged, unhealthy neurons. This scarring becomes continuous in Huntington's, causing more harm to the brain. As stated, the part of the brain affected is the striatum. Particularly, it is the caudate nucleus of the dorsal striatum that is mainly affected. Brain GABAergic neurons of the striatum provide inhibition to the globus pallidus via two pathways, an indirect and a direct pathway. The indirect pathway runs to the external or lateral globus pallidus. When this structure is inhibited, it stops its normal inhibition of the subthalamic nucleus, which is responsible for exciting the internal or medial globus pallidus, which is responsible for inhibiting the thalamus. The thalamus is the structure in the brain that relays movement information to the primary motor cortex, located just anterior to the center of the brain. With this inhibition, there are no jerky chorea movements as seen in Huntington's. The direct pathway involves direct inhibition of the internal globus pallidus by the striatum, resulting in decreased inhibition of the thalamus. In Huntington's disease, the damage to the GABA-containing striatal neurons due to Huntington toxicity leads to the disruption of both of these pathways, with the indirect pathway being affected first, resulting in jerky chorea movements early on, and the direct as the disease progresses, resulting in more inhibited movement in the later stages.
There is no cure for the disease, but the symptoms can be managed with medication as the disease progresses. Depression is a common symptom and can be treated with SSRIs. Chorea can be treated with tetrabenazine, which reduces the amount of dopamine reaching the postsynaptic cell. Benzodiazepines, such as diazepam, can also treat chorea by agonizing inhibitory GABA pathways to the thalamus. However, these medications can cause negative side effects, such as depression, nausea, and drowsiness. Antipsychotic medication, such as Risperdal, Seroquel, can be used, but with caution because these can cause increased involuntary contractions and muscle rigidity. New research has shown that exercise helps to slow degeneration but not stop it. Again, all of these methods are only efforts
to mitigate symptoms in order to improve the patient's quality of life, as there is no known way to stop the disease from progressing.